Welcome to this Google Hangout today called Why Men Matter to Improve Maternal and Newborn Health, a global conversation. And it is truly a global conversation because we are calling in from 5 countries today. And I'm honored to have an amazing panel with me today. My name is Julia Wiklander, and I'm the founder of Girls Globe. I'm based in Sweden. And the other panelist that we have today is Chika and Noya, who is the program manager for gender-based violence at Rutgers WPF Indonesia, a MenCare Plus Indonesia partner. We also have Shamsi Kazimbaya, who's the National MenCare Plus Project Coordinator at the Rwanda Men's Resource Center. Welcome. And we have Ruti Levtov, who is the MenCare Global Co-Coordinator and Program Officer at Promundo-US. And we have Oswaldo Montoya, who's the MenEngage Global Coordinator, also based in DC. So I would like to just ask all of you to introduce yourselves a bit and tell us a little bit about your work and what you do. So Oswaldo, we can start with you.
Thank you, Julia. It's really an honor to share with you and Ruti, Shamsi, Chika, this conversation. I work for the MenEngage Alliance in the Global Secretariat, actually as a co-coordinator of the Global Secretariat, and we as an alliance work in providing networking for organizations connected to the alliance, working with men and boys for gender equality. And we promote different initiatives. One of them is precisely men's positive involvement in childcare and caregiving as involved fathers. And in addition to that, we also promote men's positive involvement in sexual and reproductive health and rights, the prevention of violence against women and violence against girls and children, and many other challenging homophobia and many other areas in which it's very important that we unite, stand with women in changing societies toward really gender equitable societies and relationships. So we work as a network in different projects, in advocacy, in intervention, supporting organizations to do this work at the ground level, grassroots level.
Fantastic, thank you, Oswaldo. And how many countries is MenEngage actually active in, and your alliance is active in?
Yeah, well, we are organizing six regional networks in Africa, in South Asia, in Europe, in Latin America, Caribbean, North America, in Latin America, and there are 32 country networks that belongs to the alliance, but we are working in more than 50 countries, and some of our networks are also working in other countries in these 6 regions. And it is expanding, trying also to create new collaboration with partners, colleagues, organizations doing great job in the Middle East, in Southeast Asia. So trying to expand and provide more support to our organization connected to the alliance for this work.
Fantastic. Thank you so much, Oswaldo. Ruti, over to you. Tell us a little bit more about what you do and your work.
Hi, everyone. Like Oswaldo said, it's really an honor to be here, and it's exciting to see colleagues from around the world in my screen. I am a program officer at Promundo-US. Promundo is an organization that has been working for a long time on engaging men and boys in gender equality. And one of the big projects that we work on is around men's participation as active and equitable and nonviolent fathers and caregivers. And that's this MenCare global campaign or project that we co-coordinated together with an organization called Sonke in South Africa, and of which the sort of other folks who are here are members and contributors. And the idea is that, again, in order to achieve gender equality, in order to achieve sort of positive outcomes, health and well-being for women, for children, and for men themselves, the engagement in maternal and child health and in equitable caregiving is essential. So we won't achieve equality if roles remain really, really different. And so the campaign works in more than 25 countries. We try to work both with kind of individual men and communities, but also in transforming the health sector and transforming other sectors to encourage men's participation in, in fatherhood and caregiving and maternal and child health.
Fantastic. Thank you so much, Ruti. Shamsi, over to you.
Thank you very much. I'm really very happy to have this opportunity to share today with others about the work we're doing in Rwanda with MenCare Plus. Center, which it is a Rwandan organization, working in the area of gender, but especially promoting positive forms of masculinities. And RWAMREC has various projects, and one of them is this one, the MenCare Plus project that I'm coordinating at the national level. And the MenCare Plus project actually aims at involving or engaging men as caregiving partners or fathers in SRH, sexual and reproductive health, as well as maternal and child health. And actually, MenCare Plus is implemented in 4 districts out of 30 in the country. But actually, RWAMREC has other projects in other places, in other districts of the country. And actually, we are mainly working with fathers, and those are expectant fathers or young couples, in terms of actually involving them in this kind of, work that engages them in sexual, reproductive health, and also maternal and child health. And we are actually, practically, we are working with a group of men, those young couples or expectant fathers, but also groups of young girls and young boys. And we're having actually a program that takes about 15 sessions, 1 session a week, almost 3 months, where we are discussing and bringing people, especially men, to reflect, and discuss about their issues and the issues surrounding SRH and MCH, and actually have that free space to discuss about their problems, their needs, and the strategies actually to see themselves as involved fathers in this, health sector. And we're also working with, especially we're working with the health sector, because actually if you're dealing with reproductive health and maternal and child health, we definitely need to work with the health system. So this is one of our key partners. We are actually partnering with the Ministry of Health, and that goes down this community health workers and also the health centers. So this is mainly what we are doing in terms of MenCare Plus activities in Rwanda.
Thank you so much, Shamsi. And Siska, you are Chika. You're calling in from Indonesia. Please tell us a little bit about your work there.
Hello, it's really nice that we managed to talk at the global talk with other 5 different countries. My name is Siska, but you can call me Chika. I work for Rutgers WPF in our office in Jakarta, in Indonesia. And we basically, our work focusing on the issue of SRHR and the gender-based violence. And I'm a program manager for the gender-based violence, and I also manage a MenCare Plus, which we implement in Bahasa Indonesia as Laki-Laki Peduli. It's a men movement in promoting men involvement for maternal and child health, and also eradicate gender-based violence. But before that, we also work for developing the male counseling in Indonesia. So to give the interventions for the men, so the problem or the violence against women will be solved. Thank you.
Thank you, Chika. And for those of you who don't know Girls Globe, I work with Girls Globe, which is a global network of young women bloggers, as well as grassroots organizations from around the world that are in different ways empowering women and girls in their work. And something that we've seen in the past year that we've been very active is that engaging young men and boys is incredibly important to empower women and girls, and we cannot have a conversation about gender equality, about women's empowerment, about women's health, about maternal health or newborn health without actually talking about the role of men and boys. So I'm incredibly happy to be with such an honorable panel today to speak about these issues. So I will start off to ask a few questions, and I think that I would like to start with Shamsi in Rwanda, and I would like to ask you, why did you think it was important to start working with men on improving maternal and child health outcomes, and especially in Rwanda?
Yeah, thank you very much for the question. Actually, firstly, what I should say that choosing or think that it's really important to work with men in this area of MCH, it's first of all because men in Rwanda, in Rwandan culture or in Rwandan tradition, they play a very big role. A very big role as providers, a very big role as decision makers, and yet we have seen that men
I believe we may have lost Shamsi there. Yeah. So Chika, I think we'll continue the question with you. In Indonesia, how do you find that it's important, or why did you find that it is important to especially involve men and boys in maternal and newborn health?
In Indonesia, from the data in 2012, there were 349 per 100,000 case of maternal mortality. This is also, we can see the lack of men involvement in the maternal in MCH. So we think we want to. It is really important for us to use the target for men for education and for the key issue is training the health sectors how to engage men. So I think the problem is always about culture, religion, and the patriarchal culture in Indonesia that makes the women's health cannot be improved.
Thank you, Chika. And Oswaldo, I would like to ask you why you believe fatherhood is such an important time to actually involve men and boys.
Absolutely, it is a transition in I mean, first time that men become fathers. It's a very sensitive time for men. It's changing, their role is changing absolutely from not having this big responsibility of looking after another human beings, although they might if they had younger brother and sister or an elder who they have to take care. It's possible, but in most of the cases when men become fathers, it's the first time they have to really think about the well-being of other human beings and put their own needs in second place. And that's something that is not so much promoted in societies yet, especially for men, only on the part of economic provider. So, but many men want to play a very important role, and they are quite more open to receive advices, to receive to get help in some way to do this to fulfill this role in a best way possible. So I think it's a great opportunity. Men become anxious, fearful, happy at the same time about this new responsibility. It's something that even though you might see documentaries, film, you listen to your peers is never the same as when you are actually in this living the experience. So it's a very great opportunity for engagement about what is their role in families, what is their roles as human beings relating to others. It's a great opportunity, absolutely, and we are very sensitive to most of them, of course. There is a spectrum of attitudes and interests and motivations among men, but I would say many of them will be, if we as societies, our organizations, communities provide more opportunities for men to start reflecting and learning more about how to be an involved, a positive caregiver. Most of them will say yes, I would think.
Thank you, Oswaldo. And Ruti, MenCare is also very active with these issues. So what type of changes does MenCare promote?
So I think we sort of promote changes around the sort of across the spectrum. So the main goal is for men to participate as equitable and nonviolent caregivers in the life of their child, in the life of their partner. But it sort of happens through a range of different things. So we find, like Oswaldo was saying, that the kind of transition to fatherhood is a really excellent entry point to start addressing a variety of issues. So to address kind of equality in the couple, to address couple communications, to address nonviolent child rearing, and nonviolence in the partnership itself. So there's, so we have lots of kind of different messages, with the core one being to promote equality and participation and nonviolence. Uh-oh.
I can't hear anything.
Yeah, me neither.
Apologies.
Okay.
Chika, I wanted to ask you what type of changes you actually see, changes in Indonesia that you want to see, that behavioral changes that men and boys can actually do, and what do you want to promote in Indonesia and in your community?
Well, what we want to promote is the new form of masculinity that based on mutual respect between men and women. Because of that, their belief, when boys were born, they believe what their family or their father said, how they treat women. So it triggers them when they treat women unequal, and the violence against women happen. But it is also important for us to engaging role model, like religious leaders or cultural leaders, when we are promoting our campaign. So it is not easy to engaging men when we're talking about culture, because we believe that in so many years. So I think within the creating or providing a safe place for men to be able to express themselves, to be able to discuss, and I think we're going to transform the cultural value to a better one.
Fantastic. Thank you so much, Chika, for sharing that. And I think when it comes to social norms, it's not an easy process at all. It really does take time. And so, Shamsi, welcome back to the Google Hangout. And I would like to redirect a question to you, specifically on how change is actually being made in Rwanda and the changes that are promoted for men and boys. How is that received in Rwanda? How do men actually receive the changes that you promote?
Mm-hmm. For the question, actually in Rwanda, when I talk about changes that we are promoting, I can say that we are having kind of two groups of people, two groups of men. So we're having men who are receptive, who are actually happy with the changes, but we are still having another number of men who are still resisting to those changes. And actually, the biggest issue are having that not only men are resisting, but you're also having women who are resisting. Because actually, if we are talking about social norms and those traditions, very deeply rooted in our social, lives, it's really very difficult to change people. But the good thing is that the number of men who are changing or are happy with this change, we are using them as role models. And actually in Kinyarwanda, having a term for the MenCare Plus, we are calling it in Kinyarwanda Mandebereho. Mandebereho means role model. So what we are trying to do in Rwanda is using those role models to help us changing others. And what we have seen happening and working very well in Rwanda is that peer education works very well. When you're having men going to sensitize other men, it works really very well, instead of having women or other people coming to sensitize and trying, to see men changing. So this is a kind of strategy that we're using in Rwanda, working with those, positive men, active men, to help us changing others. Of course, it's actually a process. It's not something that happens overnight. But when we see what happened so far with the MenCare Plus project, that have been implemented since last year, almost 19 months now, we're actually having hope that the change is possible and men can really change. Yeah.
Fantastic. Thank you so much for sharing that. I think having positive role models is important for all of us, and of course, behavioral change is really difficult without having anyone to actually look up to. So Ruti, I would like to move the question to you and ask specifically what inspires you with this work, and what positive change have you seen at a global level with these issues?
That's a great question. I think, it's interesting because what is often sort of very inspiring is stories of individual men talking about sort of the power of the kind of relationships they have, the improvements that they've seen. But what's actually kind of more inspiring to me, or not more inspiring, but something that I think about a lot is sort of the structural change that happens, the sort of future opportunities that families have. I think one of the things that's really important is that for me to think about kind of this MenCare campaign, the work with men and boys, is something that we all need to do, that we have to do kind of in our everyday lives all the time, and thinking about what that means for kind of my world and my kids, and what it means for families all over the place in terms of equal sharing of care work, in terms of what that means for women's opportunities in the workplace, and what it means for men's connections with others. I think we've seen, one of the things that has been very powerful about this campaign. Again, many of our organizations have been working on violence prevention for many years, on many other projects with men and boys, and MenCare has grown very, very fast, because I think for many people the kind of positive focus on men have more to contribute than just sort of, providing economically for the family, that there are improvements for everybody that's involved, for the children, for the mothers, and for men themselves, has really kind of taken off. And again, we had a plan to have 10 countries involved in MenCare, and we have many, many more than that, and a lot of enthusiasm from people. And I get to hear stories from Rwanda, from Indonesia, from many other places that are really very inspiring.
Thank you so much, Ruti, and that is really inspiring. And I would like to just ask you, when it comes to structural changes, do you have any examples that you could share with us today?
Sure. So one of the sort of very, very exciting ones that actually just happened last week was we do a lot of work in Brazil. Promundo's originally a Brazilian organization. We also have a MenCare Plus program in Brazil, and there they've been very active with the health system on having, for example, groups for expectant fathers happening through the health system. They have a men's health unit. They certify health facilities as kind of being family friendly or father friendly, again with a focus on equality and making sure that at the same time you're sort of protecting the spaces that have been kind of female spaces for a long time. So Brazil is a great example. There's lots of examples in Central America as well, Nicaragua, Guatemala, of doing really interesting work with the health system. And then, of course, the MenCare Plus program in Indonesia, in South Africa, in Brazil, and in Rwanda, again, working with health providers and then working on kind of transforming the spaces, the systems, the protocols towards engaging men. And this is particularly in maternal and child health, but we're hoping to kind of expand more broadly, so child protection systems, things like that as well.
Fantastic. Thank you so much. It's incredibly encouraging to hear real examples of change. And Oswaldo, I would like to turn over to you also at a global, with a global perspective. What types of personal and societal changes do you think will take form if men everywhere begin embracing their roles in maternal and child health, and as well as gender equality more broadly?
Well, that would be very, and that's what we are all aspiring for, very revolutionary for societies in general, for the entire planet. This changing the way in which men relate to the world of care, of caring for people, for children, for others. It implies that also you have to change the rest of the way that the societies are organized, because at this moment still it's very fixed, very rigid in many places in which men are only focused on the productive area, on working outside home, on becoming providers, and women having double share. I mean, in addition to caring for children, for the domestic work, also they are also working outside, but still societies consider men as the providers, and as a secondary, only as an assistant in terms of childcare, for instance. And if we change that notion about what are the potential, the capacities in both men and women and all people, then I think we'll win, because we will have a societies more balanced, people more whole, more integral, in which you can choose really what you want to do, and children also would benefit from the contribution, the equal contribution from men, women, and everybody, and also, I mean, this is one key aspect of how society is organized, and I think we also have more opportunities to deal with other problems like violence, like addictions, drug addictions, because many of this is also a result of many of these problems, like violence, for instance, in homes, in communities. It's also the result of lack of connection, lack of empathy that is not nurtured in men in particular, in this case, since we are talking about men and boys. So it's the potential are enormous for people really expressing all their capacities, and for children in particular receiving benefit of everyone.
Thank you so much, Oswaldo, and I completely agree with you. I'm from Sweden, which is one of the countries with the highest level of gender equality, and also, I believe, the most men in the world who are actually, in percentage-wise, taking out paternity leave and caring for their children and their families. Recent studies have shown in this country that men are actually a lot healthier than they were 10, 20 years ago. And that change is really showing in stress levels, in how men are actually, you know, taking out other costs in society as well. So it's not only decreasing the burden on women, but also ensuring that men can actually live lives that are more fulfilling. And I would like to ask our two individuals from regional offices, Indonesia and Rwanda. Do you believe that this kind of change can also happen locally in your areas? Chika, we can start with you.
For us, when we start working with men, it's quite progressive because it's there are no other similar campaign talking about men. And the most important is that we set out the positive message when we campaigning about them. It's actually when we providing services for men, we call it male counseling. Instead of we call them perpetrator, we call them client. So we're giving positive message to be able to make men trust. Because I think when we're talking about cultural norm, men is also have their own struggle. It's not easy for them to be barrier as a man in Indonesia, because we have lots of different area which is as a man in Indonesia, it's really not easy, because they also believe when they're thinking about masculinity, they have to be the breadwinner, they have to be the leaders, and with the economic situation, it's not easy because they have to share and they have to make an equal work with women. So I think when it is important when we set out the positive message as introductions to approach them.
Thank you. And Shamsi, I would like to ask you as well. What societal and personal changes do you actually see would happen in Rwanda if men played a more active role in maternal and newborn health? Oh, you're not able to hear me. Okay, so I'll ask Chika as well if you could just also let us know how you think policymakers and other partners can contribute to your work in Indonesia to actually engage men more proactively.
Recently, I just came from the site visit to East Java, and it's actually really glad that I met one of the head of the district that really support for MenCare program. For example, supporting engaging health sectors in providing services for men. And one of their effort is to have a policy on men involvement supporting the breastfeeding. I think this is a good start for us, that actually policymakers seeing that when you want to eradicate gender-based violence, it starts working with men. And because in our country systems that we have a regional autonomy, and it's really strategic if we addressing the policy through the local government rather than national, because they can make their own bylaws, which is really supportive, and allocate their budget to support the issue of gender equality, including men engagements in the health sector. For example, training the health sectors, midwives, doctors, and I think through this support, that our programs will be sustained.
Thank you so much. I think it's incredibly important for us to involve policymakers at all levels. And I would like to move over to Oswaldo as well and ask how you see maybe globally we can involve policymakers and leaders to actually encourage men and boys to be more involved in maternal and newborn health.
We must include leaders at all levels, from communities, from countries, regional, at global level as well. And we as MenEngage, in partnership also with MenCare, we have been trying to engage, for instance, the UN system. We are working in close collaboration with UN Women, with UNFPA, with different agencies, with World Health Organizations, agencies from the UN system, precisely for that, for reaching out to leaders at global level, and also international NGOs that are part of our alliance, like ITPF, for instance, who provide a very important service from civil society, providing service in clinic, for mothers, for men as well, for families. So different international NGOs that we are working on for precisely involving all of them in changing these social norms and also the institutional practices. I think we have great potential. I think it's quite clear that if we advance in this process of engaging men and boys in maternal health and childcare, the benefit will be enormous, and leaders should recognize that. We haven't mentioned about, for instance, the impact on reducing poverty, for instance. If men contribute in, let's say, in family planning, in really negotiating the decision of when really have a baby, and how often, I mean, the spacing between one birth and another birth, that has an incredible impact in the level of the well-being of a family, the economy of a family, for instance. For instance, in my country, I come from Nicaragua. One of the biggest challenges in Nicaragua, and also it's in many other places, it's girls who are mothers at very early age, at 16, 17 years old, sometimes even earlier, 14, 15. Many of them product of sexual violence, sexual abuse, rape. And then you can see how men are driving this epidemic. And if we are able to make substantive changes in men and assuming their responsibility in terms of negotiating sex, on also recognizing when it is appropriate to engage in sexual relationship with other people, then you have a reduction. You have a reduction in this kind of early pregnancy that also put these young women at risk of death. And if they happily go through the pregnancy and the birth, then you have more challenges in terms of the health of the children, of the newborn. So in many ways, the contribution that involving men in maternal and child health has should be appreciated by leaders in all areas, in the economy, in education, the possibilities of children accessing to better education. And these are critical concerns for leaders, how we are in terms of improving this economy of societies, in terms of education, in terms of health, malnutrition. In many places of the world, children die out of something that shouldn't be dying, like diarrhea, like malaria, and in part that is because the burden of domestic work is only on women's side, and if men also contribute also to maintain, sanitation in their houses, in their communities, then you have a positive impact in health outcome for children. And that's something that politicians should be concerned of and should recognize that through this measure, this social measure, through more education, we can really make important changes and that otherwise would be more difficult.
Thank you, Oswaldo, and thank you so much for highlighting the interlinkage between gender-based violence and maternal health and all of these various aspects of gender equality in society, because I believe that we can't speak about maternal health without speaking about these issues, and it's incredibly important to hold our leaders accountable as well, and to show them the positive changes that can be made and those who are actually leading that change. And today we're actually celebrating a special day, as it is August 18th, and that means that it is the 500-day mark before the end of the MDGs. So there are 500 days until the Millennium Development Goals are due. So today we're joining a conversation using the hashtag MDG Momentum to actually show global leaders and civil society and various partners who are working to accelerate progress, both to alleviate poverty but also to improve maternal and child health, that we can't leave this out of the conversation. So Ruti, I would like to also ask you a question related to this, specifically on the Millennium Development Goals. And so what role do you see that men play in accelerating progress for the health-related MDGs, particularly maternal and newborn health?
Sure. So again, I think it's crucial, and as you mentioned, sort of from our perspective, there's no way to kind of achieve gender equality and a lot of other positive outcomes without engaging men and sort of viewing gender as something that's relational, that happens sort of between people, and is not just sort of focused on women. I think this goes back to a little bit of sort of how we started the conversation of thinking, what is men's role in maternal and child health? And we have both kind of, in many places, men as gatekeepers. I think this is what Shamsi was starting to talk about, that men often make financial decisions, make decisions about seeking health care, sometimes have more information or access to information than women do. And so it's very important for maternal and child health to address that, to make sure that men are informed and are supportive of emergency care when needed and all sorts of things like that. But at the same time, we also want to sort of break down that dynamic. We want men to not be gatekeepers, but to have decisions made more equitably, to have more kind of a balance of power that is more equitable in families. And so in terms of the Millennium Development Goals and achieving those, I think what you were saying before, that all of these issues are interlinked, right? So you can't talk about maternal and child health without talking about sexual reproductive health and rights and family planning. And you can't talk about that without talking about violence. And so, we generally are supportive of a standalone gender goal that pushes gender equality, that we think will have an impact across the board in these other areas as well. But also, again, to emphasize that these decisions or these issues don't take place in a vacuum, that you have to be thinking about the whole context.
Thank you, Ruti. That's incredibly true. And Shamsi, I would like to turn the microphone to you again to ask you specifically on what types of personal and societal changes you think will take form if men in Rwanda actually embrace their roles in maternal and child health.
Thank you, Julia. Can you hear me? Actually, I'm having trouble with connection here.
We can hear you.
Yes, thank you. So actually, the types of personal or societal changes that I think will take form, if I can say it in general way, that we'll see gender equitable relationships between couples, men and women. But most especially globally, what I see that can happen, that actually families or couples or men and women, they will improve their financial lives, as well as the education or level of education of their children. because actually we've been talking about those issues that are linked. We cannot talk about men's involvement and also gender equitable relations, especially especially when we're talking about men's involvement in maternal and child health or SRH. This cannot work as long as at the very beginning they're not active and supportive and positive in their own relationships. So actually we've been discussing this just a few days back when we've been training health providers and saying that actually once we are having positive or good relationships between men and women, having men being involved in MCH and SRH, actually it's obvious. It will be done on its own. But otherwise, once we don't have this kind of, equitable relationships, it's really very hard to involve men in MCH and SRH. Actually, we need to deal with both of them, having first those equitable relationships at the beginning, and then the rest will come on its own. Yeah.
Thank you, Shamsi. And how do you actually promote gender equitable relationships? Shamsi, did you hear my follow-up question?
I didn't, sorry.
Okay, so my follow-up was, how do you actually promote those types of relationships that are gender equitable?
Oh yeah. Actually, what we are trying to do to develop or to promote those kind of gender equitable relationships actually is creating space. First, for men themselves, so that they have, a space where they can freely discuss and reflect on their own problems. Because actually this again linked to the cultural and traditional norms that we are having. Men are used to not just, speak out about their problems, but once, and that's the good side actually for the MenCare Plus project, because we are giving space. We are giving room to men to sit together and discuss their own problems. And then after having men discussing their problems, we bring them together with their partners or with their wives. But at this point, they are feeling like they're free to talk and to discuss. And this creates, again, a space where men and women discuss about their own relationships, what works, what doesn't work, and then having strategies on how to improve their own relationships. Actually, I think the main strategy that we're using is to give space to men and women, and then provide information, trying to show everyone, men, women, and children, the benefit they're having in this kind of promoting gender equitable relations. Because actually, people tend to think that actually when you're promoting gender equitable relations, it's only for the benefit of women and children. But once men see also their own benefit, they become actually also active and supportive in promoting this kind of gender equitable relations.
It's incredibly true. Thank you so much, Shamsi. And I really appreciate how both you and Chika have spoken about creating safe spaces for conversation, because I really believe that that those spaces are so important to actually give people the freedom to express themselves and to be able to challenge social norms that are very difficult to challenge otherwise. It's incredibly important. So as our time is sort of coming to an end, I wanted to ask all of you specifically to come with a few tips to our audience and to our listeners. So what are some tangible things that men can do to contribute to positive health outcomes for women and their children? Chika, would you like to start?
Start with a love message, a positive message. Start with respecting your partner. Start with having a fair divisions of labor. It's not helping your partner when you're washing the clothes or washing the dishes, but you creating equal a space for both of you to make a healthy relationship. So your children will follow you, and you are as a role model, and you want that your child to be healthy, mental healthy, and I think, and it starts from home.
Thank you so much, Chika. Shamsi, what would you say are ways that men can actually support maternal and newborn health?
Yes. That I think men can do, actually. And the first one for them to be, first of all, being positive. Because otherwise they used to be like, you know, MCH and SRH is just women businesses. So first of all, they need to be positive. And once they are positive, they have to be active, to be involved, and also to be actually like allies, to understand that actually they're also concerned by all those issues surrounding SRH and MCH. And lastly, then to be supportive. Because I remember, again, we've been discussing with the health providers and other groups regarding SRH and especially family planning. And when we're talking about family planning method, the modern method, I mean, actually, again, men feel like they're not concerned by this one. But I think here they cannot be concerned directly, but once they're supportive, once they're supporting their partners, even emotionally contributing on those outcomes. So I think that those are the three things I'm thinking that we need to have from men: being positive, being supportive, and also being, you know, yeah.
Thank you so much. Thank you for those tips for men. Ruti, what would you say are some tangible things that men can do to contribute?
Sure. So I think, you know, Shamsi and Chika covered a lot of them, but I think we also need to think of men as sort of activists. So not only participating in your own family, but again, being sort of role models and leaders in your community and with sort of structures and institutions. So, you know, making sure that institutionally there's the support for men to have an equal role in caregiving like you have in Sweden. So paternity leave where that's relevant, you know, poverty alleviation measures, systems in hospitals that allow men to be present during childbirth. So for men to sort of request and ask and be activists together with women on a lot of these issues. And I think the other thing is for men who aren't fathers to be thinking about this and being involved in this. So it's, you know, issues of gender equality, issues of maternal child health, issues of violence, that it's not just an issue for fathers, but it's an issue for men in general.
Definitely. Thank you so much, Ruti. And I think that is something that is really important for young men and adolescents as well, to really understand that they have a role as leaders in their communities to actually be a role model and say and step up for adolescent girls, step up for adolescent boys and young boys and men in their community, to actually understand that they can make a difference and are really important to create change. So Oswaldo, what would you like to add as tangible things that men can do to contribute to positive health outcomes for women and children?
Sure. Before I refer to the importance of men as equal and respectful partners in family planning and supporting women's access to contraceptives, and also they assuming their own share of responsibility to contraceptives, I think that's one important component of men's contribution to the health of women and children, and having experiencing healthy pregnancy. But during the pregnancy period, during those 9 months, I think it's very critical the positive contribution of men in families. I have been working with expectant fathers as part of the MenCare project when I was in Nicaragua, and I was also an expectant father twice. I have 2 children, and during those 9 months, I remember very well, and I can see from other men how important is men's behavior, attitudes, as our colleagues were mentioning before, contributing to an atmosphere of respect, of love, of support for pregnant women is so critical, because we know how harmful negative stress, toxic stress can be for a pregnant woman, and men can be very loving, supportive, or can be exactly the opposite in many cases, in which men are a source of threat, of violence. We know, unfortunately, many cases in which during pregnancy, many women are victims of violence from their partners, and that's terrible, and that's conducive to terrible health outcomes. Also, accompanying women as well to go to the clinic visits, for instance, to prenatal visits is so important. Facilitating the access that women have to go to this service is another important contribution of men. Making sure that women, really pregnant women, meet all their physical needs as well, that they have proper nutrition, which I know it's very difficult in many contexts when there are scarcity, when there are poverty, but so that's also that responsibility. That's why we need, as Ruti was mentioning, we need the structural responsibilities of governments, of communities. But whatever men can do at family level in terms of supporting women access to proper nutrition, do their work as were mentioned as well, their share in terms of domestic work, taking care for the other children and family, all of that have a strong impact in the health of pregnant women, and also during birth, being very supportive of women, respect their desires. Some women desire that they be accompanied by their mother and not by their partner or the father of the baby that is born, that is giving birth. So men should respect that as well. And if the woman want that men be there, the partner be there, well, being there, making sure that she has water, that she has what she needs, encouraging her, helping her with the breathing techniques. I mean, we need also men need to learn about this, and institutions have responsibilities to give these spaces to men to learn about, for instance, what could be complications, early symptoms of complication during pregnancy, how men can be supported during birth, during labor. All of that, I think, it's critical, and are things that men can do, or they can actively hold their communities, their institutions accountable to be taught about how to support women. So we can do many things, and also to support the newborn, the children. It takes a lot of work to take care of children. It takes, as a famous saying from Africa, it takes a village to really care for a child. So women need to be equally responsible for the caring of children, and also that's so important for the health of women and also for children and for the family.
Thank you so much, Oswaldo, and thank you to all of you for sharing some tangible things that men can do, and I believe that it's really something that we can involve boys at young age to really understand that girls are their counterparts, and they have an active role to play when it comes to the health of women and girls and the health of themselves. As a pregnant woman myself, I'm expecting my first baby, and my husband is actually an expecting father that I'm living with right now, and I see that experiencing this for the first time, it is also really interesting to see how men are also really involved and emotional in this process, and need to also be involved in a certain way, because many things are happening in my body, but it's really difficult to understand it if you're from the outside. So just involving and being a part of those midwife visits, and making sure that men are welcome at those different clinics and centers, that it is not a woman's issue, but it is an issue also for men. I think it is incredibly important. and to, of course, involve young men in family planning and sexual and reproductive health and rights, and creating those safe spaces so that men can actually become those activists and become those role models that we just want to see more of. I mean, we already know of several men who are taking the lead and taking charge and showing that you can actually change the way masculinity is defined and be a father or be a caregiver and also support maternal and newborn health in various ways. So I would like to thank all of you in the panel for this great conversation we've had today. And I would like to encourage all of you who have been listening to really check out Promundo, MenCare Plus, and MenEngage as well, to just learn more about the ways in which you can be involved, but also the ways in which communities and societies are changing as men become more active caregivers and are more active in promoting gender equality. And I would also like to point out that Promundo is a featured organization on Girls Globe, so you can read blog posts about their work on our site, and we will continue this conversation and continue to write about the important role that young men and boys and men have in promoting healthy outcomes for mothers and children. So thank you so much to all of you for joining today from around the world. I'm really glad to have had this conversation.
Thank you. Congratulations, Julia, for your pregnancy.
Thank you.
Thank you.